Malaria, a Global Health Concern by Jerica Whitney. Malaria is an expansive global health concern described by the CDC as one of the most severe worldwide public health problems. There are several initiatives with goals of decreasing the disease burden of malaria on the world, but prevention and control efforts don't come without challenges and economic effects. Malaria is an infectious disease caused by the Plasmodium parasite that is spread by bites from infected mosquitoes. It causes high fever, headaches, swelling, malaise, and severe or untreated cases can lead to multi-organ failure and death. It is commonly found in tropical and subtropical countries where the environment is supportive of the mosquito life cycle. The World Health Organization estimated that 290 million people in 85 countries were infected with malaria in 2022, and of those, 680,000 succumbed to the infection. These numbers are increased from the reported numbers in 2019. Humans with limited or underdeveloped immune systems are at higher risk for getting malaria. Pregnant women, infants, and children under 5 years old have a higher incidence of infection, as well as those with hindered immune responses, as seen with HIV/AIDS infection or those receiving treatment for cancer. Travelers coming from areas with little to no risk of malaria are also at higher risk for infection due to lack of natural immunity to the disease. 3% of the world's disability-adjusted life years are contributed to malaria. In Africa, that number increases to a whopping 10%. That's because 90% of the cases worldwide occur in Africa. In 2022, the incidence of malaria was 58 in 1,000 of the at-risk population. This number was higher than the 26 in 1,000 that was expected for that year. The total cases were 249 million, making the prevalence also higher than the 244 million the previous year. The malaria-causing parasite known as Plasmodium is transmitted through the bite of an infected mosquito. The parasite is injected to the bloodstream where the mosquito bites and then travels to the liver where it multiplies and matures. The parasites are then released back into the host's bloodstream where it begins to make the host ill. During this phase, the parasite can be passed on to the next mosquito that takes a meal from the host, and the life cycle of the parasite continues. Only female Anopheles mosquitoes can transmit the disease. Malaria is not transmitted person to person, but in rare cases it can be transmitted through blood transfusions, organ donation, sharing infected needles, or from a mother to her unborn child. Countries with generally warm weather and adequate rainfall have the most malaria cases. African countries contribute as much as 90% of the global malaria cases, contributed in part to the traditional gender roles in the country with high malaria infection rates. Females are more likely than males to become infected. Age groups with lower immunity responses, such as young children and the aged, have higher infection rates than people outside of those age categories. One organization working with malaria is United to Beat Malaria, which is a campaign of the United Nations. Its mission is to eradicate malaria within a generation, and the campaign's vision is to protect the most vulnerable populations. United to Beat Malaria helps by increasing awareness, education, access to testing and treatment, as well as raising funds, providing tools such as bed nets, and advocating for populations who may not have a voice. Another organization working against malaria is the Global Malaria Program, which is responsible for coordinating the WHO's global efforts against malaria. Its mission is to support countries in implementing strategies to prevent, control, and eliminate malaria, and its vision is to eliminate malaria worldwide. They enact their mission and vision by providing technical leadership, developing new tools, and changing norms and standards to promote prevention and eradication of malaria. Of the 17 Sustainable Development Goals set by the World Health Organization and the United Nations, goal number 3 is the most important for malaria. Goal number 3 is to ensure healthy lives and well-being, and one of the targets of this goal is infectious disease, with its aim being to eradicate tuberculosis, HIV, and malaria by 2030. From a prevention and control standpoint, there are many interventions being implemented to reduce infections. Vector control interventions such as mosquito netting and indoor sprays are commonly used in areas with high prevalence of malaria. Several medications, including the ones listed here, can be used to prevent malaria for those traveling to high-risk areas, and there are other medications that can be taken by high-risk populations, such as HIV-positive or pregnant women. Vaccines are now also available and estimated to be 75% effective in children 5 to 36 months old. Vaccine initiatives are a large part of the plan to reach Sustainable Development Goal 3.3. While much work is being done to gain control of malaria, the fight has not been without challenge. Resistance to drugs and insecticides have made those modalities less effective, while increasing warm weather and rain have been supportive of the mosquito life cycle. Socioeconomic factors and societal norms tend to perpetuate the lack of access to health care and individual safety and prevention options, further challenging eradication measures. All the while, inadequate funding and difficulties creating reliable, effective vaccines and distributing them where they need to be leaves a daunting battle ahead in regard to prevention and control of malaria. As of 2022, 34 countries reported less than 1,000 indigenous cases, which was up from only 13 countries in the year 2000. 12 countries are certified by the WHO to be malaria-free. The first vaccine was suggested by the WHO in 2021, and the creation of a second vaccine is estimated to have reached over 200 million children alone. Economically, the effort to eradicate malaria has been difficult. Many malaria-containing countries are stricken by poverty, and funding to provide them with tools and medications they need is a continuous source of stress for activists and organizations attempting to help. Even though many interventions are described as cost-effective, many governments simply don't have the health budget to cover it. The heavy disease burden of malaria can also work against developing economies and perpetuate poverty in the areas it affects. While the cost of eliminating malaria is often higher than the cost of controlling it, the benefits of eradication make the cost worth striving to cover. Malaria is a global concern affecting some of the world's most vulnerable populations. Many strides have been taken toward elimination, including medications, vaccines, and other tools for prevention, but no intervention is without challenges. Several organizations work towards global eradication of malaria, and even with economic constraints, progress is being made. Here are the references. Future PowerPoint on the difficulties of hanging indentions in PowerPoint programming coming soon.